All right. Hello, everyone. So this is our next episode of the Best of Des Moines series. And today I'm very excited. We have Dr. Ashley Bauer from Mercy One ENT is here with us. And she has been a really great resource for a lot of our patients who have vestibular conditions, anything to do with their sinus cavities, breathing, all of that. And she has personally helped me out a lot when it comes to my own sinus cavities. So I'm excited that we get to have her on. A little background on Dr. Bauer is she is an otolaryngologist who specializes in sinus and skull-based diseases. She went to medical school at the University of Nebraska and did her residency at the University of Michigan, and then her fellowship in rhinology at Vanderbilt. So, and I have to ask, how long did that take you?
Medical school was 4 years, residency 5, and then fellowship was an extra. So I guess a total of 10 years if I'm not as good as math as I am other things, but
So that's a lot. That's a lot of schooling.
yeah,
Very
it is.
cool. Well, we're so excited to learn from you. A little icebreaker question, just um, because I know how you were spending your afternoon. Tell us a little bit about why your dog is in physical therapy at this time, and what does that look like for a dog to go through physical therapy?
Yeah, actually in Des Moines, there's Positive Strides, which is a doggy physical therapy place that has such great resources for dogs with arthritis or muscular problems or pain issues, neurologic issues. So they've been a great resource for me. And so my German Shepherd has hip dysplasia and a lot of arthritis issues. And so we try to go every week I take him to physical therapy, and I believe in physical therapy because, especially as a dog mom. So he goes to physical therapy and it's really helped him a lot. So we do that every Wednesday afternoon if we can make it. So
Does he have a home exercise program that he has to do?
yes, we try to do like stretching and especially with his like he gets a lot of muscle spasms. There are things that we are supposed to do, but he hates doing, and it's really hard to get him to do. It's really hard to get dogs to do. Oops, sorry. What you want them to do. So my phone just went off. Sorry. It's really hard to get dogs to do what you want them to do. But we do our best, and going there really helps a lot as well. So
Nice. Especially, I imagine a German Shepherd getting a German Shepherd to do specific exercise routines. It's hard enough sometimes with adults
yeah,
who
they
speak the
have
same
good
language.
yeah, they have good treats. We do an underwater treadmill. So he walks on the treadmill, and they do like shockwave therapy. They do laser therapy. They have acupuncture. We've done all of them. And then they even have like cones, and we do exercises. So it's a good setup.
Yeah, I'll have to go ask if I can shadow down there sometime. That sounds like it would be fun to just see what that
Yeah,
looks like. Yeah.
it
Okay,
is.
well let's jump in a little bit. Tell us about, so you work at Mercy One ENT in Clive. Tell
Yep.
us a little bit about what that looks like. What's a typical day like for you?
So usually most days I do half days in the operating room and then half day in clinic. And so usually we start in the morning just so that patients don't have to be without eating or drinking all day. So we usually try to do our mornings with surgeries and then afternoons in clinic. Surgeries can range anywhere from just ear tubes, tonsils. I do a lot of sinus surgery and nose surgery. We do larynx surgery, neck surgery. So a lot of variation in ear, nose, and throat. And then clinic is, just like you would expect any clinic to be, seeing people with all different kinds of problems. Sometimes we do in-clinic procedures. Um, and we try to get people in as quick as we can. It's always hard, but we try to have good access to care as well.
And tell us, how big is your team? Do you do a lot of work with the other ENTs, or are you kind of individualized? What does that look like?
Yeah, so I have 4 partners. There's 5 of us in our group. We have we have many hearing, our audiologists, I'm trying to count. We have 5 audiologists, so hearing people that specialize in doing hearing testing as well as hearing aids. So they definitely help patients with hearing aids as well. We have a speech pathologist who is in our clinic most days of the week that helps with voice related problems and disorders, as well as cancer, post-cancer treatment. So she's a great asset to our team. And then we have multiple nurses, medical assistants, schedulers, and receptionists that all help our entire clinic process and hopefully provide really good care to patients.
Sure. So then are there certain providers that if I'm coming in as a patient, I would see prior to seeing you as the ENT? Or what's that order of operations look like?
Yeah, so you mean like other medical providers or in our
Yeah,
particular?
or do we have like, would I be seeing PA, nurse practitioner, that kind of thing, or would I mainly see you?
So we actually have one nurse practitioner. Her name's Lindy Nordstrom. She's great. She's a great asset to our team. So she is seeing patients that need kind of urgent spots, kind of bridging care if you can't get in with a doctor. And so she does provide good care. But as we have more doctors than we have nurse practitioners, a lot of times you end up seeing a doctor first. But as we grow our team, we may end up adding more nurse practitioners or PAs as well. So most of the time, you end up seeing a doctor first, unless we just can't get you in quick enough. We have our audiologists that do hearing tests. So a lot of times, if your problem usually would require me wanting to get a hearing test, we kind of plan for that. And so when you come in, especially if it's an ear disorder or balance disorder, we plan to get a hearing test even before you see me so that I have that information to help me with diagnosing what's going on.
Yeah. Yeah. So tell us then a little bit, what's your approach to evaluating a patient, diagnosing them, and then what are maybe the top 2 things that you see in your clinic? And what do those patients, what are they saying subjectively? What's their complaint when they come to you?
Um, so I think my approach in general is just, and no matter what it says on the complaint, it's just truly trying to get a history of what's going on because people may think it's one thing and the symptoms may make me think it's something completely different. So really my biggest thought is what's going on? Like tell me your story. I know you've told a million people, but tell me your story. Let's try to go through why we think it's this, if maybe it's not that. And then trying to go from there. I have a lot of tools in my clinic that I can use to make a better clinical assessment. So I have microscopes in my room that help me see the ears so much better than what you can with just a normal otoscope. So I kind of have a leg up on primary care doctors and urgent cares because I have something under magnification that allows me to see what your ear looks like and if there's fluid or if there's not. Also, having a hearing test really, really helps me know whether you have problems popping your ears, whether you have fluid in your ears, whether you're having problems with the hearing nerve or transmission of the sound waves to the hearing nerve through your little ear bones called your ossicles. So those are tools that I have as well. And then I also have scopes in my clinic that help me go through the nose and look at your sinus openings and sometimes into your sinuses if you've had sinus surgery. I also have a longer scope that lets me look into your throat, so I can see your vocal cords, I can see the back of your tongue, I can see right above your esophagus. So we have a lot of tools that help us get to the root of what is going on. And I think it just depends. I often don't know if I'm going to do any of those procedures at all until I talked with you or a patient and I say what we need to do. I think I'm going to need to do a scope exam, and usually we'll talk to people through it right away. We don't necessarily make you come back and schedule it. Usually I can do it right then and there. I would say that uh, I would say half of my patients that I see usually come in with chronic sinus complaints and nasal complaints, just because that's the area that I focus on. But I would say the other half are general ear, nose, and throat complaints. Ear complaints drive a lot of things. Ears bother a lot of people, whether it's dizziness, pain, hearing loss, wax. So I see a lot of ear complaints, a lot of kids with with problems with fluid in their ears, ear infections, tonsils that are causing people problems. So it can be about anything that I see.
Mm-hmm. Yeah. What are some things, you were mentioning just the different equipment that you have that maybe not other providers have, including like if you just go to EN or urgent care or primary, even in the ENT world, how often do you think certain conditions are um, being missed if there's not the right equipment, or what's your experience with that look like?
Yeah, I think even for me, if I don't have a microscope and I'm looking at someone's ear, it can be really hard to see clear fluid. Clear fluid is very hard to see. And so a lot of times primary care doctors, urgent cares, they're doing the best they can with an otoscope. And even with me with an otoscope, I'm not 100% perfect. And so I do think that when some doctors say, "Oh, I see clear fluid," I think it can be really hard for that to be correct. And so when people come to me that have been told they have fluid in their ears and I don't see fluid because I've looked with a microscope or we have a hearing test that confirms that there's no fluid, it's not that anyone missed anything. It's just that they don't have as high tech of a tool as I have. And so that can happen. And sometimes I look with my otoscope and I don't see anything, and I look with the microscope and I go, you know what, I think there's fluid there.
Mm-hmm.
So I do think clear fluid is the hardest thing to see. If you have like a yellow colored amber fluid, it's pretty straightforward. If you have a really bad ear infection with pus behind your eardrum, like that also is pretty obvious. I think it's the subtle things that can be really hard. And those are usually the patients that get referred because their primary care doctor is like, gosh, it's not getting better. I can't really tell what's going on. And they send you to an ENT so that we can use all the tools in our toolbox to figure out what's going on.
Sure. Yeah. So on that note, who are your main referrals then? Is it primarily primary care providers? What is that like?
Yeah. Usually it's primary care providers. A lot of times I see a lot of patients from allergists because they are doing allergy treatment. They're not getting better with allergy treatment. They're having a lot of nasal complaints. And that's another thing that can be missed. If you're having a lot of nasal and sinus complaints and all you can see is like with a little light up the front of the nose, like it's easy to miss polyps or really bad sinus disease or sometimes really rare tumors in the nose. And so with our cameras and our scopes, like I've actually caught quite a few things that no one could see from just with a light in the front of the nose. And so I do think some of those things can be missed just because there's not everyone has these high tech cameras that with big screens, and they are expensive and also take some skill in order to do it.
Sure.
And so I do scope a lot of people because I do think it helps with diagnosis and with giving us a lot of information.
Sure. Yeah. Tell us, just because I know a lot of people listening are probably they've been dizzy at some point and have had a vestibular issue of some point. Tell us a little bit about the common conditions you guys see, and if there's and how that can correspond to vestibular symptoms.
with with uh, with all the things that we see.
You
Um,
can narrow it down if you want to just
okay,
pick a couple too.
yeah,
I know you guys see a lot.
yeah. There's definitely a lot of things that can cause dizziness. And it's always, I think dizziness is one of the hardest things that anyone sees, whether it's a neurologist or a primary care doctor or an ENT, because dizziness can come from your eyes, it can come from your brain, it can come from your ears, it can come from your ability to sense where you are in the world because you have diabetic um, problems where you can't feel as well in your hands or your feet. And so it's always, and also you can be dizzy from low glucose, you can be dizzy from your heart, you can be dizzy from your vision being off. There's so many different things that can cause dizzy and imbalance. And so ear, nose, and throat tends to be a pathway of trying to figure out what is causing the dizziness. Ears can definitely cause dizziness, especially your inner ear, whether you have a vestibulopathy where the nerve isn't working as well as it could, whether you have a disease that causes the inner ear to swell and cause episodic dizziness, whether you have crystal issues, which a lot of people do have, where the crystals can get out of position. And when you turn your head very minimally, you can start spinning. Those are things that we see and diagnose and treat a lot. Um, You can also have a little bit of imbalance from fluid in your ears. It's definitely something that we see, but it's not as common as some of those other things. You can have dizziness from migraines, headaches, sinus issues. A lot of the things we see do cause dizziness, but it's always trying to figure out what the pathway is for that dizziness so we can best treat you. And physical therapy, especially for the ears, is a huge way we treat dizziness of ear etiology. A lot of times, the physical therapists do a better job at managing patients with ear dizziness, ear types of dizziness, than we can as doctors because it takes a lot of hands-on therapy and care. And so physical therapy is really a highlight of otologic related dizzy disorders.
Mm-hmm. Yeah, I like that you mentioned that there are so many systems that can cause dizziness, and that's why we love being able to send people to you to make sure we're not missing anything. Even over the last year, our referrals to vision therapists that I know will look at how the eye is functionally working and not just the eyeball. So Elite Eye Care and Vision Park are two ones that they are, if prisms are necessary, because eyes are either there's a exophoria, they're a little bit out, a little bit in. Um, they're a big referral. Cardiology, kind of like you're talking. It really is such a team approach. So um, with with thinking about how often, and I'm sure it depends on what the issue is, but how often are you seeing your patients?
It definitely depends. Like if I have someone who has a really bad ear infection and I'm wanting to make sure that they get better, I'm seeing them maybe at a week or 2 weeks. If like I have a patient who had a sudden hearing loss, a sudden nerve hearing loss, I started on medicine, saw it back at a week, and now I'm doing injections in the ear. And so I'm seeing her every other day for injections. Um, if we're trying a new medicine and we're seeing how that medicine works, sometimes we got to give it a little bit of time. So it might be a month or two. And people that are stable who have a chronic condition I need to monitor, but they're doing okay. Sometimes I see them back every 6 months, every year.
Mhm.
So it kind of depends on how quickly I think you'll improve with whatever intervention we've made and what I'm worried about if things are going to go the wrong way, if that makes sense.
Mhm.
Yeah.
Yeah. For specifically a sinus or any kind of skull procedure, let's say it's polyps, for example, like what is a general timeline for when somebody should expect to feel better? What's the percentage of improvement you can estimate to expect? What's that like?
Well, so if you have polyps, that tends to be a chronic problem that has probably gotten worse over time. And maybe it got worse when you were sick with a virus of some sort. Um, and so I would say that if you're managing it with your primary care doctor and things are going the wrong direction, where you're getting worse, your smell is getting worse, your drainage is worse, your nasal obstruction symptoms are worse. I mean, obviously, I would probably see you earlier than later. I do try some long-term medications and sprays and nasal rinses. And I would say I give that a month or so to see if we can get some improvement. So I'll see people back kind of in a shorter interval. I wouldn't expect it. We can definitely try like prednisone and antibiotics, and those tend to help for a short period of time, but long period of time, it can take a month or two. If we aren't getting better, by the time you've gotten to me and we've tried some of these conservative approaches, that's when sometimes surgery is recommended. And sometimes people are not interested in surgery, and we can do other things that maybe aren't as definitive as surgery, but can maybe keep you at a better state for as long as you can be at that state. So I don't push people to surgery unless I'm really concerned about something being wrong. But if it's quality of life, like sinus issues and polyps, it's truly your decision. If you are miserable, surgery is an option. If you are not miserable enough, we can usually limp you along with rinses and sprays and some allergy related medications.
Mm-hmm. Yeah. So So I'm kind of want to circle back to something you said earlier, in regards to, oopsies, have an alarm going off. Lost my train of thought.
That's okay.
Pregnancy brain. Here we've got a couple of weeks until there's a baby coming, so I will blame it on that.
Congrats.
Oh man, I totally just lost it.
About like how long you would expect to improve or whether surgery would be an option.
Mm-hmm.
You have some smaller procedures in clinic that I can do that sometimes uh, can make people feel good enough, like removing a polyp or shrinking your inferior turbinates just to help you breathe a little bit better. If you don't want to go under a general anesthesia and have a bigger surgery. But obviously, it depends on what's going on with you, whether those are appropriate procedures for you.
Mm-hmm. Yeah. Um, what about this is kind of where my brain was going. You were mentioning you found some kind of scary stuff like tumors and that kind of a thing.
Yeah.
Um, what are some of those scary things? And then what are as for us as physical therapists, some of the red flags that we
Mhm.
should be aware of that would make us need to refer to you more promptly than we already do.
Yeah. I think anytime you're having weight loss and you're not intending weight loss, it's always a red flag for any medical profession. Um, Throat pain in the head and neck, throat pain that's not getting better worries me. Hoarseness that's not improving within a couple of weeks usually makes me want to look at your vocal cords and make sure there's nothing there. For nose, rarely you can get sinonasal tumors, and people who have one-sided obstruction, so you can't breathe through one side of your nose, that's new. Smell changes, smell loss, headaches, eye vision problems that are new, pressure under your eye, anything that's, if it's one-sided, we worry. But new onset headaches, vision problems, changes in your smell. I mean, those are things that I usually say I would want people to come in for.
Mm-hmm. Yeah. Um, is it is it generally a tumor like within the sinus themselves, or how are, because we often are trying to screen out like cerebellar tumors if we have a lot
Yeah.
of busy patients, like what are specifically we're thinking of a cerebellar tumor or even a history of a posterior cerebellar stroke. What are those red flags?
So cerebellar tumors or problems with the cerebellum, you're going to have problems with coordination. So difficulty with walking, difficulty with eye movement, coordination, and focus. Usually, you have problems like alternating your fingers back and forth. Um, think about it like if you were doing a drunk test, that usually affects your cerebrum of your brain. So if you have a hard time walking in a straight line, hitting your finger to your nose with your eyes closed, like those are things that would make me think more the cerebellum is involved.
Mm-hmm. Yeah. So what else can we as the physical therapist do that can help support your patients better?
I think you guys do a lot. I mean, I don't know how to say more than what you already do because I think you take the time to explain a lot of the balance disorders that we see that require exercises and daily repositioning maneuvers that we have a hard time going through and doing all of those and spending a lot of time with patients. So just taking the time to explain to patients like what you see that you're going on to see that's going on as well. And then, if things aren't adding up or if patients are not improving like you would expect, just, sending them back our way is always a good thing because sometimes, and a lot of times, obviously, we as doctors are not perfect and we may think it's one thing and it may not be. And if things aren't going the right trajectory or they're worsening, then we need to take another look at it.
Mhm. That is something I really like about my career in PT is getting to see people regularly enough that if stuff comes up, then sometimes I feel like my one of my main jobs is helping the patient find the right provider,
Yeah.
and just kind of getting them where they need to be. But we have that because we have 40 minutes with them, maybe a couple times a week. So,
Hmm.
yeah, it
It's
really,
great.
yeah, it really is. Um, one more thing I wanted to ask you, what are some of the advances in either research or maybe surgical techniques that have been up and coming that may have changed how you've been practicing since you graduated?
Yeah, I mean, I think that there's in the last 10 years or so, more minimally invasive techniques in sinus surgery. I think that as we have newer and better equipment, it's improved the access that we have to the nose and the sinuses. There are newer procedures that work on the nerves in the back of the nose that cause a lot of drainage. Like if you walk outside and your nose runs and you have to wipe it with a Kleenex all the time, that's a newer procedure called cryotherapy of the posterior nasal nerve. And that's a newer procedure that has come out. It's not as covered by insurance. So even though it does provide a lot of benefit, it's hard because I can't do it on everyone. But that is something that's a newer procedure that I think is really helping patients that are having problems with that. But I will say for a lot of ENT, if it's not sinus surgery, I will say for ear surgery, they'll use little cameras in the ears. That's a little different. It's called they use scopes in the ears that they didn't used to use. So they're just kind of changing the way they do things in ear surgery too. But in general, I think the most advanced techniques that we've had have been in endonasal sinus surgery. And that's just mainly because we have better technology now.
Mm-hmm. I know my dad will tell stories of when they cut in right above his gums
Yeah,
and has had like 6 polyp surgeries that way, and just how archaic that seems, but it really wasn't that long ago at all.
it wasn't. And, I mean, those are still procedures I can do if needed, but most people, we don't have to do that anymore because we have better techniques now.
Yeah.
So,
Yeah.
yeah.
Well, I'm sure your patients are very thankful for that too. And how often do you pack a nose anymore?
I very rarely pack the nose.
Okay.
Especially for sinus surgery, the only people I really pack noses for are patients that have to be on blood thinners,
Oh,
you really try not to do surgery when patients have to be on blood thinners, but I do have some patients that have needed to be on blood thinners around surgery. So I will pack the nose because you're probably going to bleed if you're on blood thinners. And then the other reason we still need to pack the nose, it's a different type of packing, but there's splints. And usually when you're doing septoplasty surgery or rhinoplasty surgery. And so it's a type of packing, but it's not as archaic as it used to be where it was like gauze, like coming out of the nose. So the strip gauze and packing in the nose is usually not done very much anymore.
the moral of the story is having a surgery done by Dr. Bauer is not as scary as some patients might think it is.
I promise it's not as scary.
Don't be scared. Yeah. Okay. Well,
You've heard horror stories. Just know that's not everyone's path. So
yeah. Yeah. That's a very good point to bring up, I feel like. So if you had one overarching tip to give any of your patients to improve their patient outcomes, what would that be?
um, I would say I know it's really hard, but being as honest as you can with your doctor and tell them what you will and will not do. Like if someone comes in and they're like, I'm not going to do this. Like I appreciate that. Like I understand it's what I recommend, but if you're not going to do that, let's not waste our time. Let's think about what else we can do. Being honest with what you want from this, how I can help you. I'll have to tell you realistic expectations, but it's good to know like what I best can help you with, and then what you're willing to do or what your lifestyle appropriates for you to do. And sometimes it just helps us clear a path for what's best for you. So I think that's the best thing, and advocate for yourself. If you feel like things aren't going the direction you want, I mean, definitely the more I know, the better I can do. If I think we're on the right page and we're not on the right page, then I can't help you. So I think just really realizing that if things aren't right, let me know.
Mm-hmm. Yeah. So if patients want to get in to see you, what's the best way to schedule?
So it's good. A lot of times we might need a referral from your primary care doctor, or from a physical therapist or a speech pathologist. So if you want to call, you can call our clinic to see if you might need a referral based on your insurance or what our clinic may need. and we can get a referral and get you in.
Yeah. Awesome. Well, thank you so much, one, for chatting today, but then two, just for all the work you're doing. I feel like healthcare providers don't receive praise enough. You're really helping out a lot of people. So
And thank you, Annette. I really appreciate you too.
yeah, yeah. So I know that you're going back to the clinic and just you have patients that are very thankful for you. So thank you so much. And we're excited to share this with our listeners. So join us next week, everyone, for our next episode of the Best of Des Moines series. And we'll see you later.
Thank you.
Yes.